Hi, everybody. It is exactly 1:30 p.m. Central Time. Thank you for joining me this afternoon. We've had a lot of webinars together these last couple of days. So this webinar that we're about to go through together is a practice test where we will do practice question after practice question. But these questions are all catered to that first half of the anatomy and physiology content that we did yesterday. Okay. So I know maybe some of you are joining me again for the second time today. If you are, thank you. But the content I went through earlier today, just a couple hours ago, we will do a practice test on that tomorrow. So this practice test is on yesterday's content, which is going to bring me to my next slide. Because in case you did not get a chance to jump in yesterday and learn with me, you can go ahead and rewatch those webinars. So let's take a look at everything we have to offer you here at Archer Review. So as I said, yesterday's webinar, in case you missed it, in case you miss any future webinars, okay, we have all of our webinars archived for you to access and for free, okay, for free. So make sure you scan this QR code in case you need to get caught up, or if you ever plan to, be gone, you'll be busy, you can always come back and watch that at a different time. Our current live webinars and our upcoming webinars, check out this QR code. Our webinars are always free. They're wonderful resources to help you prepare to pass your exam. So get signed up for any future webinars. And like I said, I will have one tomorrow going over the content that I taught just a couple hours ago today. Make sure you get signed up. Okay, but beyond our webinars are fantastic. They're free. You get, direct access to us educators. It's awesome. But what I'm telling you is even better, and also for free right now, guys, our question bank and our on-demand videos. By signing up, you get a free 24-hour period to our question bank and our on-demand videos. Our question bank, we have been revamping. We've got over 2,000 questions available for you with rationales for every single answer choice. And when I tell you that we have sifted through this and continue to improve it every single day, I mean it. We are trying our hardest to make this the most aligned to your exam. And honestly, based on some feedback, some people say that they were even more prepared than maybe what they anticipated for their exam by accessing that Q bank. And so besides just like sitting here talking about it, I want to show you our actual question bank and our on-demand videos, because again, you can get these resources for free right now. Let's take a look. When you hop into Archer Review, if you have an account, awesome, you probably know what this looks like already, but if you have not yet, you'll sign up for that free 24-hour demo period. And this is what it's going to take you to, your dashboard, okay? So here's your dashboard. It pops you right into your Q bank right away. Notice how there's a statistics tab, previous test, remediation, and notes. So our software is built to keep track for you all the questions that you're rocking, some of the questions that you are getting incorrect, and you have that ability to go into remediation and really focus in on those questions that you're not quite getting the first time, get a better understanding for why that is, so you can cater your needs to the areas that you need most. What I love about our system here at Archer Review is it allows you to completely personalize your learning journey every step of the way, all right? It's not a one-size-fits-all system. So beyond just the statistics, let's take you into creating a test. So you have some options for how you want to create your test, okay? You can even kind of play around with the number of questions in your test. We're going to make it timed because, your exam will be timed, and your TEAS exam, you'll actually have 60 questions. Oh, I can only give you 45. Sorry about that. But you can give fewer than 45. So go ahead and click next. And remember how I said you can personalize this? These are all your options. You can do reading, you can do scientific reasoning. Let's do anatomy and physiology, since that is what our practice test today is all about. And see how some of these, like you're not able to choose right away because you did not choose that topic. So scroll until you see some bolded options. So here are some anatomy physiology options. When I built my test, it said to only do the topics that I haven't done yet. Okay, so that's why it's ruling out some of these anatomy options. So let's go ahead and do reproductive and endocrine. Maybe these are areas that you would need more support in. You need more practice. So create your test. And here's what that looks like for you. We have set up a testing environment to mimic as best as we can your TEAS exam environment, right? Science shows that when you keep formatting consistent, there's greater success on the learner. And that's what we try to achieve here. So it's set up so much like your exam environment. You got a calculator, you've got some annotating spots, you can pause it, all the things. Okay, so that's just a little peek. Let's end that. And then I also want to show you in your free 24-hour period trial, you will have access to our on-demand videos. These on-demand videos, you can again personalize. So you can go into English, reading, math, science. I'm a science lady. Let's go into science. I can go anatomy, phys, bio, scientific reasoning, chem, but again, we're doing practice questions in anatomy, so let's just keep it consistent. And here are all the lessons in anatomy, nervous system, muscular system. We taught over these yesterday in our webinar, and you're going to get practice questions in these now. But as you know, our webinars, you guys, are just surface level material. Take a look at the muscle lesson alone. That's 40 minutes just on muscles. That's almost the whole hour of what our whole webinar is. You get so much more in-depth teaching on these on-demand videos. Okay, our webinars are fantastic. They are free. They give you surface level knowledge, but that's not going to be enough to excel at your exam. These on-demand videos, that's the ticket. Free 24-hour access to this. Now, what I want to show you with our on-demand videos, okay, you open it up, you start muscles, and you're like, oh my gosh, 40 minutes. And you know what? They're talking about stuff that I already know. I know the smooth muscles. I know cardiac muscles. But you know what? I want to fast forward. What I don't understand as much is some of this stuff later down the road. Okay. So how does this look when it comes to like the medical test results? What about some disorders or conditions when muscles aren't working properly? That stuff I don't know as well. You can jump right ahead to what you need. You can individualize your learning journey entirely. So let's go ahead and jump in there. Let's learn a little bit about muscular dystrophy.
Muscular dystrophy.
Okay, so what you're seeing here is more of a blank screen. You're not seeing our content. That's just for security reasons. I promise you, once you get signed up, you will see a screen. You will see this one is Dr. Harshberger, another amazing science educator here at Archer Review. And so that's what you will see when you go into the video at that time spot. But I'm not done, guys. I'm not done. When I tell you that, like, we are invested in your success, I truly mean this. Take a look at what else we have for you to go along with each lesson, okay? On the right-hand side, we've got your handouts. This is going to give you access to the entire slideshow used in that lesson. Okay, the entire slideshow right here. You can download that, print it off, annotate, add your own notes as you work your way through this lesson. But what I think is honestly even better is our cheat sheets. These cheat sheets are like a one, maybe two pager of all the essential takeaways from that lesson. Look how nicely organized. Amazing visuals. I said this earlier in my webinar, but like if I was still a student going through school, these would probably be printed out in poster size, laminated, hung up around my study spaces. I would have them in my notes. They would be everywhere. They are awesome. They take all the essential takeaways from that 40-minute lesson, condenses it, beautiful visuals. I mean, just a great resource. So You will have access to all of that in that free 24-hour period. Okay. So those are on-demand videos. They are key, I believe, to your success as a learner, as someone who not just wants to pass your exam, but to really excel in passing your exam and retaining this knowledge along the way. Okay, so let me go ahead and get back into our presentation so you can get those QR codes. Of course you want those QR codes, right? It's a free 24-hour period. You have nothing to lose. Go ahead and scan right here, question bank on-demand videos. Get access to those resources that I just showed you. Okay, and then just a couple more things before we start and while we wait for a few more people to hop on. Just checking my chats quick to make sure that we're good to go. All right. Okay, two more QR codes I want to bring to your attention from this page. These are our packages down at the bottom. So I know once you get into our question bank and our on-demand videos and that 24-hour time period runs out, you're going to want more. I promise you that. And I hope you do, right? Because 24 hours is just not enough for you to really prepare yourself to pass that exam. So our two packages are down below. The first one I'll talk about is Sure Pass. And the Sure Pass package gives you a discounted rate to access the question bank and on-demand videos beyond that 24-hour free period. All right, so this is going to give you a longer extension at a discounted rate. The other option, Sure Pass Pro option, you're getting it all. You're getting the question bank, you're getting the on-demand videos, but what's included in this is an hour of tutoring for you to use however you see fit, okay? And I like to mention that this package here will save you money in the long run, as opposed to saying, you know what, I'm just going to go Sure Pass for now. Let's do QBank, let's do on-demand videos. I'm not sure if I need a tutor. And then your test is a week away. And you're like, man, this stoichiometry stuff in chemistry, oh, the muscle contraction stuff in anatomy, I'm just not quite 100% on it. I'd love a tutor. So you go to our tutoring options and you find Dr. Harshberger on there, and she is more than willing to work one-on-one with you or even in a small group, right? She will be there for you. We will offer tutoring for you separately. But if you get that built into your Sure Pass Pro option right away, it will save you some change in the long run, okay? We will be there for you either way, no matter which circumstance leads you back to tutoring. We got you. But it will save you money in the long run if you do that Sure Pass Pro option up front, okay? And like I said to my earlier webinar today, when I was a student, I just didn't have access to resources like this. I just don't know if I didn't realize what was out there or if there just weren't as many online learning platforms back then. I'm not quite sure, but I do know as a biology major, former pre-med major, I have a master's degree. I've done schooling and I've done it while having families and I've done it while working more than one full-time job. Okay. And I understand that sometimes you just don't have the extra change to invest in a supplemental study system. But I'm here to tell you guys, this is truly affordable. I wouldn't be sitting here promoting it and as passionate about it as I am if I didn't truly believe that. So make sure that you do get that free 24-hour period and then just look into these packages we have available for you, our future pre-nursing students. So take a look. Hopefully we've got you hooked up really well. Okay, one more QR code and then I'll stop jib-jabbering and we'll get to our practice test. This is our webinar feedback survey. Okay, so I just want you to scan this now, have it ready to go so you do not forget. As I said or alluded to earlier, as an educator, I'm here to serve you. And I do my best to provide what I can in our 1 hour period we have together. This is free. It is very surface level. I can only do so many practice questions, so much teaching in between. But with that in mind, what other ideas or what constructive criticism do you have to share with us? What are some positive things we're doing? I would love to hear it. I want to hear your voices. So please scan this QR code, have it ready so you can fill this out, and just give me your feedback at the end of this. Okay. That was it, guys. That's all of my promotion, and we're going to go ahead and begin with our practice test covering the content we learned yesterday, Anatomy 1 through 6 topics. So how I'm going to set this test up is you will have on your TEAS exam, you'll have about 60, well, you will have exactly 60 minutes to cover the science portion of your exam. All right. And about I think 18 of those questions are anatomy based, and there's about 50 questions in total. So, I mean, rounding, but some simple math, you'll have about 1 minute on that actual exam. So I'm just going to give you 1 minute. I'll have the timer going up here for each question. I'll start the timer as soon as we get that practice question popped up. And I am going to try my best not to read out loud your question or your answer responses, right? Because you have to be able to read it and comprehend and figure out which answer is best. Now, the public school teacher in me, naturally wants to just support and read out loud for you. So forgive me if I accidentally start that. I'm in the middle of breaking that habit. I'm getting better. So I want you just to know, though, it's going to be a little silent at first. I'll pop the question up. I'll start your timer. And when that 1 minute is done, then we will talk about it together. All right? All right. Awesome. Here we go, guys. Let's get that timer ready to go. You're going to have a little bit extra time as I get this set up here. All right, your timer has started. All right, our 1 minute is done. If anybody is really opposed to the volume on this timer, please let me know in the chat. I can go ahead and get rid of that sound. Some people like the sound because it, prompts them to finish up. So just let me know if you're really strongly opposed to it, and I will gladly remove it for you. Okay, question 1. The mid-sagittal plane separates the body into, and I see some correct answers in the chat. Great job. Our correct answer for this is A. Mid-sagittal plane separates that body into equal left and right halves. Okay. I also saw some people share out answer D. I understand where you're coming from for this question, but it is incorrect. You instead were thinking sagittal plane, which is just left and right, doesn't have to be equal, just, somewhere divides the body left versus right. Mid-sagittal is that medial, right down the middle, separates it into equal left and right. The transverse plane, answer B, was also incorrect. This will separate the body into the upper and lower halves, so like right at that hip range. And then answer C was incorrect too. The frontal plane separates the patient's body from the front versus the back. Remember, frontal or coronal, it's going to separate front because that word frontal, same. And then front separates from the back. Okay. One more thing I should mention too that I forgot to earlier. If you're joining us on Zoom and you are sharing your answers, And thank you for sharing your answers. Please share your responses in the chat. I want to get feedback for how well are we doing on these questions, okay? And it helps me understand, like for this question, maybe why some of us were choosing the incorrect answers. I can try to understand that situation better. So if you're on Zoom, only I can see those responses. All right, only I can. If you are joining us on YouTube or Facebook or Instagram, those are public responses. I hope that doesn't deter you from wanting to share out your response, but I do just want you to be aware of it. All right, let's move into question 2, and your 1 minute begins. All right, question 2 says, which of the following correctly uses the term lateral? Remember, lateral is away from the midline of the body. This is opposite from medial. Medial is the midline, lateral is away. So think about these different features on your own body. Which features are away from the midline when compared to the other feature, which should be more towards the midline? The correct answer to this question is answer C. The eyes are located laterally to the outside of the nose, which the nose is in the center of the face, right? So the nose is medial, which means that the eyes are on the outer sides of the nose. This makes the eyes lateral when compared to the nose, which is medial. Answer A was incorrect. The nose in between is in between the eyes. This means that the nose is medial. Okay. Answer B is incorrect. The mouth is medial and superior to the neck. And answer D was incorrect. In anatomical position, your palms are facing forward, right? So if our palms are facing forward, that actually means that our pinkies are towards the medial, towards the midline of our body, as opposed to the thumbs, which are actually on the outer portions of our body in that anatomical position. Okay, let's move into some questions over the respiratory system. All right, welcome back. Sometimes that 1 minute can go fast. Question 3 says, what is the correct pathway of air exiting the respiratory system? So yesterday when I taught you the pathway for the respiratory system, I was teaching you how air enters, how you inhale. But now I want you to apply that into the reverse order. How does the pathway of air exit the respiratory system. And remember, that will begin in the reverse order, that will begin in the alveoli, the site for gas exchange. Answer C is our correct answer here. When you exhale, air is leaving the alveoli, the site for gas exchange, all right? So the blood is offloading into the alveoli, it's giving off the carbon dioxide. All right, it's not transferring blood into the alveoli. The blood is diffusing carbon dioxide out of the blood and into the alveoli so it can be breathed out. So this means it's going to move from the alveoli, then into the bronchioles through all that lung tissue, then into the bronchi, those two subdivisions separating the left and the right patient half of their lung tissue, then up through the trachea, which is that windpipe, into the larynx, and finally into the back of the throat, the pharynx, before exiting your system, whether that be, out through your mouth or through your nose. Answer A was incorrect. If you chose this pathway, I believe you were thinking about how air is inhaled, not how air is exhaled. Okay, so be careful when you are reading your questions. Answer B was incorrect. This path is just disordered. For one example, the larynx comes after the pharynx, right? Pharynx is that first stop, then the larynx moving more inferior. So this is just a jumbled disorder. And answer D, also disordered. For example, the trachea should come before the bronchi. All right, let's reset our timer. Move on to question 4. Okay, question 4. And I just gotta say, guys, I am seeing all correct answers for this one. So good job to you. Maybe our conversation on the previous slide helped you out a bit. Either way, you are paying attention. Awesome job. What structure is the site for gas exchange? You guys know it. It's the alveoli. Remember, those alveoli are those small clusters. They look like grapes, in my opinion, like clusters of grapes at the end of the bronchioles. They are structured in this way to maximize surface area for gas exchange. But alveoli, that's the spot. That's where oxygen will diffuse and carbon dioxide will diffuse for inhaling and exhaling. Answer B was incorrect. The bronchi are those two branching airway sections at the base of the trachea. It separates or moves that air into the right or the left lung tissue. Answer C was also incorrect. The trachea or your windpipe transports that air from the larynx to the bronchi. It's got nothing to do with gas exchange, and it's not even next to the alveoli even. Answer D was also incorrect. The bronchioles are those small airways in the lung tissue that lead up to the alveoli. So they will simply transport air from the bronchi to the alveoli, but not the site for gas exchange. Question number 5 begins. All right, question 5 says the body exchanges what gases in the lungs? The correct answer for this is C, oxygen and carbon dioxide. These are the two primary gases that are exchanged through diffusion in your alveoli. When you take a big breath in, oxygen is currently diffusing out of the alveoli and into your bloodstream. And in return, carbon dioxide is diffusing out of the bloodstream and back into that alveoli so you can breathe out. And a fun fact about that, when you hold your breath, guys, and that you have that need to just let go and take a breath, it's actually not your body's need for oxygen. It's your body's desperate need to get rid of carbon dioxide. Okay. So, good question to ask. Sometimes I think that, well, most people know what we breathe in and out, right? But sometimes when I talk this over with my students at the high school level, sometimes they don't always remember that we breathe in oxygen and breathe out carbon dioxide. So, I just wanted to make sure that we're clear on what gases are exchanged through diffusion at the alveoli. That means answer A was incorrect. Nitrogen is absolutely abundant in the air that we breathe, but this is not a gas that is exchanged during respiration. All right. You may be breathing it in, but it is not exchanged during respiration. Answer B was incorrect. Oxygen, one half of that option was correct, but not nitrogen for the reason we just said. And answer D incorrect. Again, oxygen, that part was correct, but not hydrogen. Okay, moving into the cardiovascular system. Thank you for everybody who's here today sharing your answers. I greatly appreciate you. It helps me better understand your thought process. So keep that up. You guys are doing good. Here's your first question on the cardiovascular system. Okay, question 6. The left atrium receives blood from the which structure? Now, I want to give you guys kudos again for your answer choices. I'm seeing good, correct answers, and I will say there's a lot of structures when it comes to the heart and the comings and the goings and the vessels and arteries, and it's just a lot. And then you add the flow on top of it. So great job to those of you who worked this one out correctly. The left atrium, that's the patient's left side of the body. That's going to be blood coming from the lung back to the heart to be delivered to the body. So we're talking about systemic circulation here. And that's going to involve the work of the pulmonary veins. Answer D was correct. Pulmonary veins are going to be found on either side of the heart, right? Because we've got lungs on each side of that heart, and it's going to bring blood into that patient's left atrium. That's where blood from the pulmonary veins will go next, the left atrium. Answer A was incorrect. The left ventricle, you got the right side there, right? The patient's left side, but the ventricle is inferior to the atrium. It has to pass through that left atrium first, then down into the left ventricle. Answer B was incorrect. The superior and inferior vena cavas. This is a different circulatory or circulation, right? This is going to be pulmonary circulation on the patient's right side of the body. So completely different system on the opposite side of the heart. We're circulating deoxygenated blood on that side, nothing to do with the left atrium. And the answer C was also incorrect. Pulmonary artery, this will carry deoxygenated blood away from the heart of the right ventricle into the lungs, whereas the left atrium deals with blood coming back from the lungs. Okay, let's move on to question 7. Okay, out of all of these structures, the one structure that is a part of the systemic circulation is answer A, the aortic semilunar valve. This valve is going to control the flow of blood from the patient's left ventricle moving into the aorta. Once it is in the aorta, it will be delivered to the rest of the system or body we talked about yesterday. System or body used interchangeably. So aortic means that it is moving to the aorta, and the aorta moves that oxygen-rich blood to the system. This is the only feature that is a part of the systemic circulatory system. All other options are a part of the pulmonary circulation, okay? Pulmonary. So answer B, this valve is on the right side of the heart. That I believe we're referring to the tricuspid valve on the right side of the heart. This is again pulmonary circulation. Answer C, the right atrium. This receives that deoxygenated blood from the vena cavas, and it will send, or it'll continue to push that deoxygenated blood through the rest of the heart to get to the lungs. That is pulmonary circulation, not systemic. Answer D, also incorrect. Right ventricle, that is just inferior to the right atrium. So the same pathway we're talking about here. Deoxygenated blood is pumped into the pulmonary artery, leading to the lungs. This is pulmonary circulation, not systemic, like your question is asking for. So you really have to keep track of the structures and the flow of the heart. Some of the names of those structures will help you remember the direction that that blood is flowing to. Let's move into question 8. All right, question 8, and keeping track of time, I think I need to be a little quicker on our question to question transition. So for question 8, if a person is experiencing backflow of blood from the right ventricle back up into their right atrium, definitely in a direction we don't want blood to be flowing, what structure is not doing its job? And the correct answer here was D, the tricuspid valve. Remember the tricuspid, right. Okay, hear that play on words there, right side. So we know if we're looking at the right ventricle and right atrium, we're looking at that valve between the two. It's the tricuspid valve. which is, to maybe help you remember too, an atrioventricular valve. So here you hear that word atrium and ventricle because it's the valve between the right atrium and the right ventricle, making it an atrioventricular valve. It's not doing its job. Okay, blood is back flowing. Answer A, the atrioventricular node. This is a node involved in electrical current passing through the heart to help with contractions and heartbeats. We didn't cover that yesterday. It's certainly content that you would get in our on-demand lessons. So make sure that you're checking out those on-demand videos because that's a whole crucial part of the cardiovascular system that you do need to know for your exam, but it was not covered yesterday. Answer B, the mitral valve. This is also the bicuspid valve. This is an atrioventricular valve, but it's on the patient's left side, wrong side of the heart there. And answer C, kind of like answer A, the SA node, the sinoatrial node, another node involved in the conduction. This is actually your natural pacemaker, but again, not a valve that is in control of the flow of blood. Let's move into the digestive system. Question 9 starts. Okay, question 9 says, what is the main function of the small intestine? If you chose answer B, you are correct here. The job of the small intestine is to absorb nutrients. This is, out of all the different structures, this is the main organ for absorbing all those macromolecules from your diet, whether that be proteins, sugars like carbs, lipids like fats, nucleic acids, you name it, it's the job of the small intestine. Now, answer A was incorrect. I did talk yesterday about how the small intestine does a small amount of digestion, right, in that duodenum. However, it's not the main role by any means. Answer C was incorrect. Absorbing water is the main role of the large intestine, also known as the colon. And answer D was incorrect. Storing waste is the job of the rectum, not the job of the small intestine. Let's move into question 10. All right, for question 10, if you chose answer A, you are correct. This is the esophagus. The esophagus is the tube structure that connects the mouth down to the stomach. And remember, it's going to help move that food along down to the stomach through peristalsis, which is the muscle contractions. Answer B was incorrect. The small intestine is found after the stomach when we follow the digestive system. It does not connect to the mouth in any which way. Answer C is incorrect. The trachea is actually a part of the respiratory system. It is not a part of the digestive system. That tube, though, the trachea, your windpipe, does run up and down right alongside the esophagus. If your epiglottis, if your larynx does not do its job, food and drink could accidentally get down into the trachea, which would, wreak some havoc on your lung tissue. But this is certainly not in the digestive system. It does not connect the mouth to the stomach. Answer D is also incorrect. Your large intestine or your colon is much later in the digestive process. It's nowhere near connecting towards the mouth. Okay, moving on to the nervous system. Let's go ahead and tackle question 11. You guys are doing great. Keep it up. Okay, when it comes to the nervous system, the structure that carries signals to the body, so all other parts of the body, and then back to the brain is the peripheral nervous system. For those of you who chose B, you are correct. The peripheral nervous system will include all the nerves beyond the nerves, like not including the brain and the spinal cord. Remember, brain and spinal cord is central nervous system, CNS. If we're talking about taking signals, carrying it to the rest of the body, could be down to like your toenail, for example, your extremities, and carrying that signal all the way back up to the brain and the spinal cord, that is the role of the peripheral nervous system. Answer A is incorrect. The command center really is the role of the brain, which is in the central nervous system. It does not refer to a specific function like carrying signals. Answer C was also incorrect. This was the result or action. I think it was muscle contraction, if I remember right. Muscle contraction. This is a result or an action. It's not a structure. Muscle contraction is simply a response to a signal. But what structure carries that signal in order for the muscles to contract? Certainly the peripheral nervous system. And then finally, answer D, also incorrect. The brain and the spinal cord, your central nervous system, processes information. It relies on the peripheral nervous system to send it signals, right? But this is where the information is processed. This is not what's actually carrying the signal to the rest of the body. Okay, question 12 begins. Welcome back, everybody. I love this question because I think it puts you really in that clinical setting. A patient is experiencing delayed reflex responses and reduced nerve signal speed. When you do some diagnostic imaging, it's revealed to you that there's some degradation along the axons of their peripheral neurons. Based on this finding, what structure is damaged? It's not doing its job. If these axons are degraded, what structure is damaged? And what was that primary function? If you chose answer C, you are correct. What you would find is that the myelin sheath, this insulating protective layer that wraps itself around that long axon of a neuron, has to be faulty. It has to be damaged. If the axon itself is degraded, that means that the myelin sheath has gone with it. It's also degraded. Okay. Answer A was incorrect. Dendrites receive signals, but they do not protect the axon. They are not even going to be wrapped around the axon. They are going to surround the cell body, not in charge of insulating at all. Answer B is incorrect. The cell body will hold that nucleus and it will hold organelles, and it's essential for that command center for the neuron, but it is not conduct signals, right? It doesn't conduct signals along the axon. Instead, it will send signals down along the axon. And D was incorrect. Axon terminals, they are involved in releasing those chemical neurotransmitter packets we talked about yesterday to the next neighbor, the neighboring neuron. It is not involved in insulating or protecting that axon or signal speed. Let's move into the muscle system, our last system, and your minute begins. Okay, what muscle type would be involved in the muscle contractions in your stomach, allowing you to mechanically digest food? Also, though, I mean, the stomach allows for chemical digestion, but if we're talking just muscle contractions, it's mechanical digestion. And that is the role of smooth muscles. For those of you that chose C, good job to you. Smooth muscles, we said, are muscles that are going to be found mostly in hollow organs in your stomach. A perfect example of a hollow organ, at least when you're hungry anyway, right? Once you like, I don't know, eat at a buffet or engorge yourself on some good food and you're so full, it's probably not hollow at that point, but you get the point. Answer A was incorrect. Cardiac muscle is unique to heart only, right? So if we're talking about the stomach, you can just rule out cardiac muscle because we are not talking about the heart. Answer B was incorrect. Skeletal muscles connect to bones and creates movement. This is not the workings or the role of the stomach. It does not connect to bone. It does go through peristalsis and muscle contractions to move food, but it doesn't contribute to overall movement of your body. Answer D was incorrect. Striated muscle includes both cardiac and skeletal muscle. And when we're talking about the stomach, we're not talking about a striated muscle. It's made up of smooth muscle. Question 14. Go ahead and begin. Question 14 asks you, when actin and myosin are overlapped, does that mean muscles are degraded, relaxed, not working properly, or contracted? When actin and myosin are overlapped and cross bridges are formed, that means that the muscles are shortening, they are contracting. If you chose answer D, you are correct. Answer A was incorrect. Degradation refers to muscles, breaking down, not working normally. And if actin and myosin are overlapping, that tells you that those muscles are functioning as they should. Answer B was incorrect. When a muscle is relaxed, actin and myosin filaments are not overlapped. They are separated. They're in this resting state. And answer C was incorrect. An overlap in actin and myosin is exactly how muscles do work. It's exactly how they should be functioning when they are contracting. This means that they are working properly. Okay, and we do have a few minutes, so I'm going to go ahead and do these last couple of questions. I like to do questions, and I know your exam likes to do questions where it asks you to think about like multiple systems together. Okay, so I'm going to go ahead and ask you a couple of questions to finish out our hour together about multiple systems working together. Which ones are the systems that we need to identify? Let's go ahead and begin. Okay, a patient has come to you and shared that during strenuous exercise, their breathing rate and their heart rate increase. Well, that probably means that they're healthy, right? If we're exercising, their breathing rate's going to increase, their heart rate's going to increase. What two organ systems are responsible for this? Responsible for delivering more oxygen to muscles and removing that carbon dioxide as they exercise. And the correct answer here was C. The respiratory system is going to allow for your body or your patient's body to exchange oxygen and carbon dioxide. And then the cardiovascular system is going to transport that oxygen and deliver that waste of carbon dioxide back to the lungs. So we've got our cardiovascular system and our respiratory system working in tandem, delivering those gases where they need to go, whether it's back to the lungs, whether it's to the muscles, all so that you can continue to exercise. Answer A was incorrect. The nervous system helps to regulate breathing, but it has nothing to do with transporting gases. Okay, that's the role of the respiratory system and the cardiovascular system. It may send signals, for different parts of the body to work together or to sense the need, but it is not directly involved in transporting those gases. Answer B was incorrect. Muscles will use the oxygen. They're simply there to receive it, but they do not transport it. And answer D was also incorrect. Answer D was, if I can remember, muscular and endocrine. So we described muscular, right? But the endocrine system's not involved at all with your gas exchange or the delivery of those gases. Okay, we got one more minute, so let's go ahead and do another one. I'll set the timer for you. All right, guys, our last question for our hour together. And it says, a person suddenly stands up after sitting for a long period and briefly feels dizzy. I'm sure we've all probably experienced that to some degree for one reason or another. Which two body systems work together to sense that change and restore the proper blood flow back to the brain? So, two key words here in our last sentence tells you the answer: blood flow and brain. So, we're choosing the nervous system and the cardiovascular system. The nervous system will sense and detect those changes. It will communicate with the brain, the spinal cord, and your nerves, and it will communicate back to the heart to help it beat faster so that your blood vessels can tighten. So we can make sure that we're constricting and driving blood flow back up to your brain so that you don't faint. Answer B was incorrect. Skeletal and muscle systems will help in movement and support, but it does not regulate blood pressure. Answer C was incorrect. Digestive and urinary systems are involved in processing waste and nutrients, but not a part of circulating blood flow. And answer D was also incorrect. Muscles and the respiratory system will support the exchange of gases, but not regulating blood pressure. All right, guys, that wraps up our 1 hour webinar. I'm going to go ahead and jump to this feedback survey. If you enjoyed, if you gained something from this webinar today, please scan this QR code, give me your voice, share with me what went well. What did you enjoy? And also think about some constructive criticism too. How can we better serve you and your needs through these webinars? What would you like to see? What would you like to see differently? Just give us your ideas, please. I'll linger on this for one moment before I jump back to our other QR codes. Okay, I'm going to go ahead and toggle back. Here's our different tutors, guys. So here's Brandon in math, Dr. Harshberger in science, and Miss Tammy in English and reading. So when you sign up for any kind of tutoring session, these are the educators that you get to work with. You can work with them one-on-one. You can work with them in small groups. And remember, if you join the Sure Pass Pro package, you will get an hour of tutoring however you want to use it built into this package. Okay. So I want to bring your attention back to everything we offer you here at Archer Review because there's free stuff. And you guys, you can't go without it. I'm telling you, you just can't. In order to excel, ace your exams, feel so confident, we've got you covered. So please take a look. Our free live webinars. I've got another one tomorrow, another practice test on anatomy tomorrow, covering the second half of the anatomy content. So this practice test was over anatomy lessons 1 through 6. Tomorrow's practice test will be over anatomy lessons 7 through 12. So make sure you scan that QR code, get signed up, join me again tomorrow at 11 a.m. 11 a.m. Central Time. If you've ever missed a webinar, you know you're going to miss a webinar. You just want to dive deep into our archives, but give us some grace, right? For those of us who I've been doing webinars for about a year now, but in the beginning, it wasn't always so smooth sailing. So you can dive back into webinars from years ago if you want to. Our webinars are free. We've got them all archived. You can find them here in this QR code, but they are surface level, right? They're free. They just touch the surface. Our on-demand videos, that's the golden ticket, guys. Our on-demand videos, like I showed you, you can see all of the different lessons. You can go into much greater detail on each one of those lessons. You can jump around within those lessons, taking advantage of the timestamps. You can access our lesson notes. And if you're anything like me, you're going to print out these cheat sheets on poster size paper, laminate them, put them in your binders, however you study, put them up in your walls. They're beautiful, okay? You're going to get all of that in our on-demand videos, and they're free for 24 hours, along with our Q Bank. Over 2,000 questions structured just like our practice questions today. All right, over 2,000, you guys. Our system keeps track of the questions that you do really well at, and it keeps track of the questions that you don't do as well at, and you can go back through them to just get better every single time. This is free, 24 hours. What are you waiting for? Get signed up right now and start practicing so that you know your stuff by tomorrow's practice test that you guys will join me with or join me on. Okay, I'm going to go ahead and jump back to this QR code for the survey. I'll hang around for another minute or two just to check the chats, make sure that you guys are good to go. And thank you so much for joining me on this Thursday afternoon. I can't wait to see you guys all back again tomorrow, 11 a.m. Central.